This has been a very challenging year for our nurses. COVID-19 has drastically changed the conditions of their workplace.
More bureaucracy, exactly what the Canadian healthcare system needs. Hi, I'm Brian Lilley, political columnist with the Toronto Sun. We've all seen the headlines, and they're across the country. It's not just an Ontario thing. Claims that the healthcare system is on the verge of collapse. There is a crisis going on, we keep being told. Not enough nurses in the country, not enough doctors. We need more healthcare workers. We need to revamp the system. Don't worry, Justin Trudeau and his Liberal government are coming to the rescue. No, they're not going to sit down with the premiers and have a discussion about healthcare funding, that 22% that they give as opposed to the 50% promised, or the claims that they are defenders and champions of public healthcare while underfunding the system from their end. No, they're not going to do that. In fact, they continue to resist calls, even this week, from premiers to have a meeting. No, instead, what the Trudeau government is going to do is add another bureaucratic position. On Tuesday, they announced that Dr. Leah Chapman would become the Chief Nursing Officer of Canada. This is a position that existed for many years, but was eliminated more than a decade ago. But now it's being brought back. Look, I have nothing against Dr. Chapman. I don't know her. I'm sure she's a lovely person, an accomplished nurse. She is a registered nurse in the province of Ontario. She, I'm sure, is very intelligent, knows what's going on. My problem is with the position. If we've got a nursing shortage, if we've got a real problem going across the country, then how does adding more bureaucracy help? This is a job that's going to come with a big salary by Ottawa standards, most likely over $300,000 or close to that amount. It's going to come with either a chief of staff or a high-level executive assistant to go with it, a whole range of support staff. It's going to be a very expensive office, all added on to Health Canada. Health Canada, if you don't know, is an organization that has more than 11,000 employees. They don't run any hospitals. They don't provide direct care to people. They don't make sure that your loved ones are looked after in the hospital. No, they are bureaucratic paper pushers. That's what they are. They look after policy. They have ideas. They attend conferences. They hold symposiums. They don't provide care, and neither will Dr. Chapman or whoever holds this position. That is my issue with this. More bureaucracy is not what we need in the system at the moment. If Justin Trudeau truly wanted to show that he was helping with healthcare, that he cared about the problems going on in the system right now, he would sit down and hold meetings with the premiers, but he won't do it. Before he was elected in 2015, Justin Trudeau decried what he called a $36 billion cut that Stephen Harper was enacting on the healthcare system. What was that cut? The Harper government said that they would drop the annual increase in healthcare spending from 6% to 3%, with some adjustments for population growth and inflation, but from 6% to 3%. Well, Trudeau thought that was horrible while he was in opposition, and then when he took government, he kept that position and told the premiers they would have to accept it. In fact, the so-called cut that Harper enacted didn't take place until 2017, 2 years after Trudeau was in power. So this is a man who talks out of one side of his mouth. He says one thing, he does another. This is a man who says he's the champion of healthcare in this country, but won't have a meeting with the premiers because he doesn't want to give them what they want, which is more funding. They're asking for more than he's able to give at the moment, but he can create more bureaucracy. But that's something that Trudeau likes. That's something Trudeau understands, and it's something he's comfortable with. Actually fixing problems, that's not really his forte. Let me know what you think. Drop a comment down below, share this on social media, and don't forget to subscribe to our channel.